begin tonight with Dr. Andrew Healy. He's a perinatologist, a specialist in at-risk pregnancies at Bay State Medical Center. Full disclosure, Bay State Health Systems is an underwriter for Connecting Point. We talked with the doctor about the Zika virus, which is thought to be especially dangerous for unborn babies if a pregnant woman is bitten by an infected mosquito. Dr. Healy says there's a lot of confusion about Zika, as he gave us a primer on the current situation.
Well, I think the implications of the virus have yet to be well defined. There certainly is a concern about an association with a condition called microcephaly, which is a devastating condition. This condition is when the baby's head size is small, and the reason the head size is small is because the brain is small. Babies with microcephaly are at increased risk for complications such as blindness, deafness, seizures, developmental delay. But the truth is, we don't know the significance of microcephaly caused by the Zika virus because these babies are still very young and they have yet to show the impact of the microcephaly. What's important also to understand is that this concern for microcephaly comes from predominantly out of Brazil, where the incidence of microcephaly went from about 300 cases or so up to about close to 4,000. And this happened along the same time as people coming down with the Zika virus. And the Zika virus has been isolated from some of these babies, but it's not clear that the Zika virus necessarily causes the microcephaly. Are there other factors that need to happen to result in this condition? Certainly that is the concern at this point, but at this point it's just an association.
The science just isn't complete at this point, fair to say?
Correct.
Okay. With that in mind, the concern is this virus transmitted, we think, primarily by a bite from the Aedes mosquito, generally found in the tropics, not in our area, not in the U.S., so it would seem, unless someone's traveled or is traveling, probably safe?
Well, the mosquito is not found. There are two mosquitoes, and one of them, the one that more commonly spreads this virus, is found in the Gulf Coast, some of the Gulf Coast states, Florida, but it's certainly not up in Massachusetts. There is a second type of mosquito that they believe is capable of transmitting it as well. That mosquito reaches a little bit further north along the East Coast, but again, not into Massachusetts. So I don't think we have a huge risk here simply because this mosquito doesn't reside in our area, from this, from a mosquito biting an infected person and then spreading it by biting another person and spreading the virus to them.
If someone, a woman or her partner, because there is, I gather, some question of whether or not it be transmitted through bodily fluids, through sexual contact,
correct,
has been in the tropics, thinks they were bitten by a mosquito. There's a lot of qualifications here, but what sort of concerns should they have in terms of symptoms to watch for or things to look for just in their health and behavior, perhaps?
Well, the symptoms that are concerning for Zika infection include fever, joint pain, red eyes or conjunctivitis. A rash is actually quite common, but only about 1 in 5 women or 1 in 5 individuals who are infected actually have any types of symptoms. So, as a high-risk pregnancy doc, my concern is for patients who are pregnant with a history of travel. The CDC recently revised their guidelines. Originally, they stated that if you had a history of travel to one of these high-risk areas and these symptoms, and you experience these symptoms either while you are abroad or within 2 weeks of return, you're a candidate for testing. And they have now changed it to anyone with just a history of travel who's pregnant. A history of travel to a high-risk area is a candidate for testing. So they've kind of loosened the criteria for testing.
Fair to say, from where you sit, and granted every patient's case is unique, but you would advise someone, be careful, know what you're dealing with, think about what you're doing, but don't panic.
Well, panicking is never helpful, I think, in any situation. My advice to pregnant women or women trying to become pregnant is to not go to any of these areas. And then a more recent recommendation is for the male partners of these women, if they have traveled, they should be using a condom because it's believed that the virus can be present in semen for longer than it is in the individual's blood. And there is a documented case of sexual transmission of the Zika virus. So that is an area of concern.
Well, Dr. Andrew Healy, thanks for coming in and giving us some perspective on the Zika virus. Appreciate your time, sir.
My pleasure.